as always. We welcome you if you would like to introduce yourself in the chat with either just yourself or yourself in your or agency or neighborhood or member of the community. You are welcome to. We're glad to have you all here. And we start off our meeting. We are officially called to order. We have quorum. We start off all the meetings with a land acknowledgement. So, P, are you going to read off that today for us?
Yes, I will.
Thank you.
Okay. The San Francisco Health Commission, San Francisco Department of Public Health staff acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples.
Great, thank you. We're moving into item number 3, and there should be, let's go ahead and make sure the agenda link is in the chat, please. That's great. And we are now at item number 3, which is the welcome. The member roll call has been done behind the scenes. We do have quorum, thank you. And we are opening this up for public comment on this topic. Okay, I'm not seeing any public comment, no hands up, and no notes in the chat. So let's go ahead on to item number 4, which is the approval of minutes from November 5th. Okay. Do I have any changes, corrections, adjustments? Okay, I'm not seeing any hands up. I'm not seeing any notes in the chat. Great job on capturing everything, folks. Let's go ahead and do I have a motion to approve minutes as they are?
Motion to approve.
Thank you, Chester. Chester has moved to approve the minutes as is. Do we have a second?
Hey, Susie, this is Michelle. I second.
Thank you, Michelle. The motion has been seconded. All in favor? This is for Food Security Task Force members. Please raise your hand.
Okay. That's 9.
Super, please lower those hands. Any abstentions?
Two.
Okay.
I didn't mean to clap. I meant to raise my hand.
Okay, that's okay. No worries. Looks like 2 abstentions. Any nays? Okay, great. That item has passed. Thank you so much. And again, thank you guys for taking such complete notes. Appreciate it. Any public comment on item number 4, the approval of minutes? Great, not seeing any. We'll move on to the next item. So we have a time we put at the beginning of each meeting just for other public comment folks have on food security, food justice issues. Okay. I am not seeing any hands up, and I'm not seeing any notes in the chat. Okay, great. Then we are moving on to item number 6, Food Security Task Force member updates. So this is Tiffany and the DOS group with their presentation. Thank you so much.
Actually, Tiffany and DOS and CFAT were presenting together, just to make that
Fabulous.
clarification.
Okay, great. So we have items number 6 and 7 are together. So this is both the Department of Disability and Aging Services and the Citywide Food Access Teams, CFAT?
Yes, that's correct.
Great. And this is so Cindy and Tiffany.
And yes, also Mike Zog is
Right.
here from DOS also. So it'll be
Great.
the three of us.
Great. Welcome, y'all. Okay, thank you for clarifying. We're looking forward to it.
All right, great. So I'll kick things off. Good afternoon, everyone. I'm Cindy Lynn. I'm the manager of Citywide Food Access here at the Human Services Agency. Today, I'm joined by my two colleagues over at DOS, Tiffany Kearney. Tiffany, do you want to introduce yourself?
Yeah, hi everyone. I'm Tiffany Kearney. I'm the lead nutritionist here at DOS.
Thank you, Tiffany. And also Mike Zog. Mike, do you want to introduce yourself?
Hey, good afternoon, everybody. I am Mike Zog. I am Program Director of DOS's Office of Community Partnerships. We are the unit where we have Tiffany Kearney as our lead here on nutrition services. We have had a member of on the Food Security Task Force for as long as I can remember, so at least a decade, which is something that I'm pretty proud of. I suspect that means the group may know what we do, but essentially we do a lot of the work between the Department of Disability and Aging Services and community-based organizations. A big focus of that is nutrition, which is about it's over a third of our annual budget and kind of approaching 40% of our annual budget that DOS uses for community-based organizations.
Great. Thank you, Mike, and thank you, Tiffany. I'm just going to kick off our presentation. Pete, could you go to the next slide, please? Thank you. So just to kick off a little bit about HSA's role in the food security landscape here in San Francisco. We are tasked by the feds and the state to administer a lot of the primary safety net resources, such as CalFresh and Older Americans Act senior meals. We manage nearly 75%, I think currently maybe closer to 78% of the city's food funding. And we provide a majority of the food resources to the recipients. And so we've had over 40 years of partnership with CBOs in providing food services to community members. And much of our funding, especially over at DOS, is backed by state and federal revenue streams. This is just a pie chart to illustrate the city's investment in food. This is the same chart that was in the last biannual report. Next slide, please. Thank you. Just to do a basic slide about CalFresh, because Jamila is the CalFresh expert in this meeting. We do administer CalFresh at HSA. On average, we give out $240 per household. As you all know, that was disrupted earlier in November. And so many of you know this because we said this at this meeting as well, but we did roll out a one-time grocery card to CalFresh recipients. That went out to all 82,000 households who were on CalFresh at the end of October. Those letters went out November 3rd. If we can go to the next page, please. Thank you. So since then, we have passed 72% in activation of these one-time grocery cards, and this is across the city. So it's pretty tremendous that we reached 70% for something that we rolled out so quickly, and that was so new for our CalFresh recipients, right? Again, that was really in response to the federal shutdown that occurred. It feels like forever ago, but it did delay CalFresh benefits for CalFresh recipients in California for about, I believe, 7 to 8 days. And so in that unknown, the city in partnership with philanthropy fundraised and got everything together to roll out these cards on the 3rd of November. So I want to thank all of our CBOs for partnering with us and amplifying messaging, and also to help your community members either activate the codes or unlock the cards. This really took the whole city to get people to 70%. Our final reminder for community members in relation to the cards is they need to activate their codes by December 31st of this year, so by the end of this month, or the funds will go away. If they have activated the funds prior to December 31st, the funds can be used until March 31st of next year. So that's really critical for roughly the 30% of recipients who did not yet activate their cards. Next page, please. And here I will turn it over to Mike.
This one is mine. So I think HSA and DOS, we kind of grounding ourselves in our goals and strategies and how we frame approaching food security in the city. I think we start with our goals, which is thinking about reach and meeting diverse high-need communities via partnerships with community-based organizations serving in those communities. Thinking about efficiency, where we can, we will try to balance buying power against culturally relevant and high quality foods to make sure we're considering cost and reducing waste. And then finally, dignity, kind of thinking that we're providing services that reflect choice and people's needs and preferences. So how do we go about that, meeting those goals? We use a variety of different strategies. I think all of these are pretty familiar to folks. Groceries, grocery programs, prepared meals, purchasing power, which we're sort of describing ways that people are able to use vouchers and other sort of opportunities to purchase groceries themselves. And then something we call hybrid, which is kind of a blend of the above strategies, as well as some other program models that are smaller in scale that we operate. I think on the next slides, I'm going to send it over to Tiffany Kearney to kind of talk us through the different strategies.
Hi, everyone. I'm really happy to be here and share what both CFAT and DOS and our other partners at HSA are doing. So the next few slides are going to go just kind of sort of give a little bit more detail in terms of what programs falls within the strategies that Mike just talked about. So specifically under the strategy of groceries, again, just sort of an overview. This is, programs that allow folks to, it provides fresh produce, grains, proteins, and, really sort of focus on individuals being able to prepare meals in their preferred style of food and cuisine, etc. So within CFAT, they have many partners that have a grocery access program. They also have the pilot program with the D10 market. Within DOS, we have our food pantries, and we also have home delivered grocery programs. And then with the economic support and self-sufficiency folks, they have the immigrant food pantry assistance and food pantry program. Next slide. So another sort of overview is our meal program, which really is shared by CFAT and DOS. And those, this category is meals that are essentially prepared, and they are, they're congregate, to go, takeout, or home delivered. So within the CFAT group, they have a program with called, I think it falls called Meal Support Program. Not as familiar with the names with CFAT, but Meal Support Program for DOS. We have home delivered meals. We have communal dining, and within communal dining, there's also to-go meal nutrition services. And there we have multiple contractors providing various different cuisine types. With home delivered meals, we have various styles: frozen, hot, chilled, 5 days a week, 7 days a week, etc. Sort of trying to really, tailor meal service to the client's needs. Deliveries can be, daily, a couple of days a week, just sort of depending on what the client's needs are. Next slide. And then with the strategy of purchasing power, I think this is led by CFAT, and that is the grocery voucher program. And again, that gives, the purpose of that is to provide vouchers for folks to access at stores and farmers markets across the city, again, focusing on choice, and for folks to be able to prepare foods to their liking and within their culture. And then lastly, we have sort of this hybrid model. Again, sort of both CFAT and DOS have programs within this category, and this sort of blends groceries, meals, and other resources to sort of meet the needs of the population. So for DOS, we have some culturally responsive nutrition support. This includes groceries as well as specific programs that do very tailored outreach to communities that are underserved. We also have a nutrition as health program that is focused on sort of healthy outcomes, a little bit, in the food is medicine sort of area. The meals are tailored for specific chronic diseases like diabetes, hypertension, chronic renal disease, etc. And then for CFAT, they have a program called Food Production, and that is working with urban farmers that provide freshly grown produce to low-income households in the community while training BIPOC youth as apprentices. On that, I think that's those slides. Next slide. I think I'm going to kick this one over to Cindy.
Thank you, Tiffany. So we also wanted to share some updates because both sides, but this is specific to CFAT, we released two big RFPs around February of this year, and that resulted in just having different grantees in our portfolio. Overall, it reduced the number of grantees, but increased our number of sites because we have grantees who are now operating multiple sites. This resulted in greater investment in District 11, and we're serving more people in District 11 than previous years, which we're really thrilled about. As we all know, District 11 has a lot of need when it comes to those who need food support, but overall, a lot of folks in D11 are accessing public benefits, which tells us that they are generally low income. And so being able to increase a site in D11 was really aligned with our goals in CFAT. Looking forward, I think this is not a surprise to anyone, but we do also have some budget constraints that we have to reckon with, right? So everything gets more expensive, the cost of food goes up. We know that ever since COVID, food prices have been really unsteady, but they never go back down, right? They only go up. And so that's going to be a persistent challenge for all of our providers, as well as the cost of labor, because we all want to provide livable and good wages for those who are providing services to our constituents. But yet at the same time, the available funding remains a challenge, right? We, of course, do not have the same budget as the height of the pandemic, but nonetheless, the need is persistent in community, right? So as a result, in our current RFP, in our current contracts and grants, we are providing less frequent services because of the budget constraints, but we're trying not to disenroll participants. We're simply trying to see if we can keep them in the program by serving them less frequently, right? But that's definitely something that we and our providers are reckoning with on a day-to-day basis. So I'll turn it over back to Tiffany to discuss DOS.
Okay, so yeah, similar to CFAT, DOS also released multiple RFPs in last fiscal year for new grants to start in fiscal year 25-26. And we, for the most part, we had mostly the same number of partners with just a couple of exceptions. We have one less provider for congregate nutrition services and one less provider for home delivered groceries. And this was because those community-based organizations opted not to apply for the RFP for their own reasons. But the number of contractors for our communal dining, we have 9. We have 2 contractors doing culturally responsive supplemental groceries. We have 1 contractor doing the culturally responsive support and outreach. We have 1 partner for food assistance. We have 4 partners for HDG, 8 partners for home delivered meals, and 6 partners for to-go nutrition services. There is some overlap with providers, but these are providers with separate grants for each of those programs. Next slide. So as Cindy alluded to, we do have budget constraints and cost challenges. DOS as a whole did not receive a $3 million Dignity Fund increase for this fiscal year. And unfortunately, a portion of that would have gone to support nutrition services this year. We basically had flat baseline funding. Again, as Cindy talked about, rising food and labor costs really has increased sort of our contracting pricing. And as a result, we don't have as much purchasing power due to those rising service costs. So, I mean, essentially, a dollar just does not buy what it used to, let's say last year or 4 years ago or whatever. So that is, we did through contract negotiations, we have used, and maybe that we can go to the next slide. Actually, I'll talk about what we did to kind of shore it up in the next slide. But as a result of all that, so some of the current impacts that we're having on programs, which I know people have heard about, we just essentially have fewer congregate and to-go meals available daily at communal dining sites. We have a reduced number of daily meals for home delivered meal clients. Prior to prior to this fiscal year, we had providers that were able to provide up to 2 meals per day. We don't have as many providers that are able to do that. We also have, as a result, we've also had an increased number of consumers on our wait list. We have had some weekend services discontinued or limited, and sort of across the board, we were able to, throughout the years, support some nutrition counseling, which has been which we needed to eliminate with this last nutrition RFP process. And we have had a couple or some closures of dining sites. Next slide. So, planned and ongoing efforts to address some of these impacts, which I had started to talk about just a second ago, is that we are utilizing annual Dignity Fund savings to bridge some of these funding gaps and to sustain core services. I had mentioned that we did have some site closures, but with some Dignity Fund savings, we have been able to bring a couple of those back online this fiscal year, and we have a plan to bring one more back online this fiscal year. We're also working in partnership with our providers, again, utilizing savings to try to, one, just increase contract levels this year, and possibly bring serve some services back, maybe not quite in the same format, but maybe for those sites that weekend service may have had to be discontinued. We're trying to work with our partners to get that back up and going again, utilizing some savings that we have. And we're also, again, kind of talking about exploring strategies, maybe, for, let's say, for example, a breakfast program that was working on Saturday and Sunday. Again, it may not be quite the same, hot meal. Maybe it's more of a chilled meal that, but at least in that format, we're able to serve clients that need that support on the weekend. So again, we're working very closely with all of our partners to again bridge those gaps as best as we can with the funding that's available. Okay. And I think the next few slides is just a listing of sort of grantees. I don't know if anyone wants to talk. These are for information only. Again, these are just our current list of grantees that are have grants with us. And I think that is our presentation. Is that right? So yeah. So I think Mike wants to you want to say something?
No, I don't know why I waved either.
Oh.
Was saying, yay, happy to answer questions. I got excited, I guess.
Yeah, we're all here and available to answer questions as best as we can. I think if we don't know the answer, we'll circle back.
Great. So we'll open it up first to questions and comments from the Food Security Task Force, and then we open it up for public comment. Chester, question, comment.
Yeah, I want to thank HSA for all that they've been working with, particularly in the Bayview area. Things have gotten better overall over the last 2 or 3 years. The reality is that parts of D11 still have to be reached, but it's a lot better than it has been in the past. We kind of work with them because we're kind of based in D10, but we also have clients in D11. So, and we're totally HDG. So it has gotten better. There's still a lot more to do. I'm hoping that if there's any way that any other funding may come back, that you can somehow get in contact with some of your ongoing partners, which we are one, to make that area a lot better than it is, because there's still a little bit of a food downplay in some areas, but it's like I said, it's better. And I want to thank you guys for all the hard work that you've done. So thank you.
Great, thank you.
Thank you, Chester, for your comments.
Other questions, comments? I have a question. I know this is really tough. I'm hearing the challenges around the increased costs and feeling like constricting budgets. One of the recommendations for the Food Security Task Force was try to eliminate particularly wait lists, particularly for vulnerable or populations that might have more issues accessing food. So is there how do you make these tough choices? Like, I know you've got your priorities, and are we seeing are these long wait lists that we're talking about? And how are you addressing those?
Mike, do you want me to answer?
Well, Tiffany, you probably have the HDM. Start with the HDM waitlist
Yeah.
number, because I know you have that for sure.
Yeah. So Cece, to answer your question, sort of we again, sort of knowing, when we sort of issued contracts, we, knowing that we were going to have reduced buying power, the OTO that we sort of the Dignity Fund savings that we used, we prioritized home delivered meal services first and foremost, to make sure that nobody was disenrolled or had to stop services. So that is, so in terms of like where we're putting funding, that's first and foremost, to make sure that those that are being served were not taken off services. Our home delivered meal wait list has grown, and how our system works is that folks are prioritized. They're given a sort of a priority score, and our nutrition partners pick off that list, but they pick off based on the highest priority. So if someone has a priority score of, let's say, 80, and then there's someone with a priority score of 20, that score of 80 will be picked up first and foremost. DOS also has emergency services. So, if they call into the hub and a referral is made, and it's determined by our social workers in the hub that this really is an emergency services, we do have an emergency provider that is Meals on Wheels, and they are able to pick those clients up very, very quickly. So I hope I answered your question, but there is priority based on for HDM in terms of, and we also, again, sort of, again, with the highest need.
Super, thank you. Other questions or comments from, again, we're starting with Food Security Task Force and then opening it up. Thank you guys for the comprehensive overview too. It's really helpful to have your priorities and an in-depth look at the profiles of who you're serving and through what organizations. So thank you for that. It's appreciated. Okay, I'm not seeing, are we seeing any other questions? Okay. Let's open it up to public comment. I know that there's some chat in the chat, or if there's other plans for a community market similar to the D10. Then there was a note that there is a Rafiki Coalition is currently operating a community market in D10. Any plans for more community markets?
I think, to be frank, we're in day 2 of the budget season. We have to get our budget instructions to see what we can propose. So I cannot say that there are either firm plans or no plans. We kind of have to figure out what our resources are. The Rafiki Coalition market is next door to our D10 market, but I want to make a clear distinction that the Rafiki model is not funded by HSA. And so if, Jenna, your question is specific to, is HSA funding another food empowerment market? At this time, we don't have a definitive answer because we haven't gotten our budget instructions, and we want to make sure we have the resources to support another one before we comment officially.
I do have another question while I'm not seeing, and I'm looking for other questions or hands up, but Tiffany, it is interesting in terms of the CalAIM work around food as medicine, that there's a real effort to enroll folks in medically supported food interventions, including medically tailored meals, medically supportive or medically tailored groceries, and produce prescription programs. Is there any communication or overlap between DPH efforts in those areas and folks who might have medical needs corresponding with those interventions and eligibility? Because I know that there's a lot more room for enrollment in the CalAIM medically supported food programs through the San Francisco Health Plan.
None that I'm aware of. Mike, have you heard of anything? I don't know if, sort of at higher level, like leadership is working with DPH. We do have another type of program where there's some CalAIM involved, but it's not for food. So I'm gonna, maybe Mike has more to add.
Yeah, I can add just sort of bits and pieces. DOS is not directly involved in CalAIM food work. We are doing a couple of the community supports and enhanced case management. So I'm, executive leadership at DOS has had some crossover with DPH. I don't think there's any ongoing coordination regarding nutrition programs. What I know and how we do our enhanced case management and things like that is that the enrollment in that program typically has to be a referral out of the health plans. And I don't have a good sense of how you kind of push below that level.
Super, thank you. All right, any other comments, questions?
Stacey, sorry, I'll just add, I do believe there are a few DOS providers who are doing it. You probably know that already, but
so, crossing over with have contracts with health plans and the city.
We do have providers doing that type of work. It's just not, it's separate from DOS.
Got it.
And to clarify, DOS is in the pipeline on some of the ECM and community supports work.
All right, Chester.
Is Guillermo online? Guillermo, are you on Zoom today?
Yeah, he's here.
Okay, because the reason why I asked is because the Bayview medical board, I think has had some activities within the community involving nutritional health in relationship to food, but I have not been on top of that. So I wanted to ask if he had heard anything about that, because there has been some very minimal things that have happened, but there's not a regular program. So that's what I've heard, in the back area. But we're trying to advance that because our community is very high on all of the negatives, diabetes, um, dementia, everything is over 60%. So my reality is anything like food that can help because some eating habits are bad. I have to say not good. And that can help a lot to the kinds of things that they have because the kind of food they're used to eating isn't the best sometimes. But they're getting better. And we're trying to change their attitude on what they're doing. So that's been the real good thing about it. But like I said, I'm not sure exactly, but don't give up. Don't give up on us. Okay.
Great.
Thank you.
Love it. Super. Okay. Well, thank you guys. Really appreciate it. Again, the going through that in such detail. I really appreciate that update, especially going into the budget process that we are going into and the challenges that you all have. So really appreciate that. All right, we are moving into item number 8, which is CalFresh changes and updates. I know, Jamil, you just got back, right, from being out today. I think it's your first day back, so welcome back. I don't know if you have any updates. We do. I did want to share a PowerPoint that was presented in the Health Commission that I want to share with you and make sure people have resources. There's been a number of webinars on this. HSA had a couple of them, but around the changes with HR1. But Jamil, why don't you go ahead and give us your latest, and then I'll share some of those other resources. Oh, we can't hear you.
Sorry. Can you guys hear me now? Can everyone hear me now? Sorry.
Yeah, for sure.
All right. Yeah. So in terms of the HR1 changes and updates that I provided in August, there isn't much to update at this time. A couple of the policy changes that we're really keeping a close eye on are the return of the work requirements, also known as ABOD, and the change in LPR eligibility. We have yet to receive official guidance from the state in terms of an implementation date. So right now we're running programs for those two components in the kind of the pre-HR1 criteria. So, I mean, as of now, in terms of the work requirement, we haven't discontinued anybody or removed anyone from the program for non-compliance of the work requirement. We're not doing any of the accountable months that the work requirement policy requires. So right now we're just still in a holding pattern and waiting for implementation dates from the state.
Is December or January the potential ABOD date that things could start?
Yeah, I mean, prior to HR1, January 31st, 2026 was the date that the waiver was that we kind of had tagged as ready to expire. Because of HR1, we're not sure if that is still in effect or not, and what criteria to implement. Right? HR1 increased the age limit for people that need to meet the work requirement. So at this point, we're just not sure when to apply those rules in our program. So there's a few if dates that CDSS has given us, but nothing for sure. In the background, we continue to keep a close eye on it. We're trying to prepare our training material for that, try to see where we need to update business processes. But yeah, still no official go ahead yet from the state.
Okay, I want to share a bunch of resources and then open it up too, because as we know that the government shutdown and the delay of the SNAP and this amazing effort to get replacement out to folks in those cards, but way before then, so many folks were at the doors of these community-based organizations and at neighborhood organizations really worried about their funds. And I know that there's still a lot of anxiety and confusion. There's still a lot of anxiety as well around the separate issue, but creates a lot of anxiety around ICE and any efforts around changes in immigration or anything like, and that is creating a lot of fear and creating a lot of barriers to access for our folks coming out. So trying to get as much information as we know to community providers, so to kind of I guess the question I have is what should we can go through this, which has a little bit deeper impact of what we expect, but right now, what is the communication that you all are giving to SNAP participants and in preparation? Oh, you're muted again. Sorry, JMO.
Sorry, can you hear me now?
Yeah, totally.
Okay, sorry. Yeah, so right now we haven't, because there isn't an official start date yet, there hasn't been any like official, hey, this is when it's gonna start. Everything has been just kind of, this is coming, these changes are coming, we just don't know when yet. Continue to engage or apply for CalFresh if you need it, continue to meet all of the requirements, your reporting requirements, your recertification, your semi-annual reporting requirements, as is. But at this point, we haven't really officially communicated like start dates to people. It's just kind of things down in the pipeline, things that are coming. I think we've updated our sfhsa.org website just to kind of let people know that things are coming, things are changing. But because we don't have the official guidance, it makes communication a little difficult.
Great. Cool. So I want to share with I've got some of those resources on the, we can start to, I'll just paste some of these in here from the SF HSA website. And we can share this. This has been one of the most helpful public documents that I've seen. Again, there's a lot of discussion on both the state levels and around advocacy around the HR1 cuts, not only for food security, but also for Medicaid and access. So this was presented on the 17th to the Health Commission. If you want to go forward, this has a really nice summary. This from HSA. Want to keep going forward a little bit? Yeah, keep going forward. Next, yeah. So here are some of the key provisions. Again, we'll list this. This presentation is linked to the Food Security Task Force website, but also is available on the HSA website. It has a really good overview of some of the eligibility requirements. Again, like Jamil said, they're still waiting on the state, right, to confirm some of this, but this is some of the what has been the key provisions of this HR1 and the impacts on the state budget. But you'll notice the work requirements for CalFresh, the cost sharing for Medi-Cal, for premiums and co-payments, and the enrollment freeze for state-only Medi-Cal for undocumented. Again, there's a big overlap between people on SNAP and Medi-Cal. So I think there's in the state, or at least in the nation, I think there's like a 75% overlap. So some of these participants might be seeing a double hit for both their health insurance and their food security, food access. The big thing that people don't know about is these substantial new penalties to the states if they have CalFresh payment errors. And that one is, I mean, I think there's a threshold of like 15%. California's at about 11% right now. So if there isn't a change, that could be, some folks we're talking about billions of dollars, maybe $2 billion in potential cuts. So I think that's something that people are keeping an eye on. That is a bigger picture, not as quick as the short-term CalFresh work requirements. That's more immediate, but could have substantial impacts. And again, this other one on the immigrant coverage limitations is also the Medi-Cal cuts for undocumented adults and restrictions on lawful immigrants' eligibility for CalFresh. Okay, let's go to the next one. These were some key dates and timelines. Again, that January, it has to be confirmed, right? But this is some key dates to be looking at. But there's some of these changes could happen as early as the end of January, sounds like. Go to the next slide, please. These are the high level projections that we've seen for DPH, some of the potential cost increases from these cuts, from Medi-Cal enrollments decreasing, reimbursements decreasing, and then revenues loss from workload and then between 25,000 and 50,000 San Franciscans projected to lose Medi-Cal coverage, and almost 21,000 could lose CalFresh benefits by the end of 2027. So those are the early predictions, but I think those are some of the numbers that we might be looking at and anticipating. Yeah. Does this sound? Is this is all? And then this just has. Oh, go ahead. Again, these are just impacts of San Francisco and California. So, so these are just some of these projections that we see as this impact of this. So when you're hearing about like what is this impact on this HR1, this is some of the current projections that we're seeing. Is there anything else there? I think that's, oh yeah, here's one more. Oh, go down, if you could go down one. Yeah, right here. Perfect. Again, many people that are parents with young children can be exempted from this particular ABOD. And again, this is more around the legislation is talking about. This is not necessarily what as Jamil is saying, there's not yet information out about what's the current plan, right? They're still waiting for state to confirm before there's official, right?
Yeah, one thing we do know is that the work requirement is going to apply to people aged 18 to 64. So it'll be a higher age that needs to meet the work requirement, not 59.
So that's an error. Thank you for that. Yeah. Okay. Great. So this, I think that's about it. The other pieces just go a little bit more into some potential budget impacts. Yep. Yeah, thank you for verifying that. So they also want to give people the resource. There was a HSA also presented a webinar on this, and this is available on their website. So want to make sure people have access to those resources. Questions, comments so far? Okay, so I think we'll be certainly looking forward to using the Food Security Task Force as a, please feel free to use this as we get information available out to folks, because again, there's a lot of folks asking and wondering and concerned. So we want to make sure that folks that are not going to be impacted by these, right, will continue not to access services, and then make sure that we as community providers and the groups together are communicating the correct information out. So if there's more resources that come out, make sure we get them, and we'll happy to get them out to folks pretty quickly. But there's yeah, that's the latest. And again, sorry, let me make sure we get there's a recording of the HSA presentation that was done as well. I want to make sure everyone has access to. Okay, let's open this up for other questions, comments on CalFresh changes and updates. Okay, opening it up for public comment. Okay. All right. Great. Well, thank you, J Mill. Sorry to just like literally come back, and we're having you present on something that's a real challenge for HSA and for all the folks. I know that these are not these are changes that you are waiting to hear back from the state and are trying to mitigate as much as possible. So I appreciate that, and keep us in the loop. And again, we're happy to make sure we're trying to communicate appropriately around the strategies to make sure to again mitigate these changes. Okay. Any other? No, I'm seeing no more public comment, and I'm seeing no hands up, and I'm seeing no notes in the chat. Okay, we'll go on to our next item, which is updates and emerging issue. Oh, I'm sorry. It's the status of Food Security Task Force and next steps. Great. So, as you know, we have been meeting with key stakeholders, particularly supervisors and their aides around food coordination in San Francisco, and the recommendation for the Food Security Task Force for a centralized food coordination and community advisory board. Again, we've met with supervisors, these offices, Walton's office, Chan, Fielder, Dorsey, Mahmood, and we have Chen coming up next week. We do have a supervisor who's willing to sponsor legislation for a centralized food coordination with a community advisory body. So they had their offices just asked for a little more details of what that proposal would look like. So we are preparing that, and if you're interested in participating in that, there's a group of us. The office, we're just waiting to confirm when they're public, Cindy, before I present that. But we just want to confirm before I make that a public statement. But we'll let you know as soon as we do. So we will put together a draft for the office, and with a fleshing out a little bit more detail of what this looks like. But that's encouraging news. Again, for those who did not hear from last time, that is the direction we'd like to see. That's the future direction. Again, this was a long-term process done by the Re-envisioning Food Security in San Francisco subtask force of this that is making this recommendation after 11 months of looking into what other cities do, and San Francisco being very behind in this. and the ability to address some of this coordination silos and really proactively address some of these food security issues and food justice issues in San Francisco. So the other two pieces of this were what's going to happen then with the Food Security Task Force. And again, we're hoping that this new structure would subside the need for the task force. So we could either phase out the task force, or it has also been recommended for elimination from the task force on committees group. We also have a July 1st, 2026 date for when the this current task force will expire. Now we have supervisors that are willing to reauthorize the task force to offer legislation to reauthorize the task force. So should that be something needed, we have supervisors willing to lead it, and then a number of these supervisors, at least 5 of these supervisors, willing to support that. So sounds like either way, there'll be something happening. Again, the task force on committees work is not, they make a recommendation, I think in March. It has to be gone through the Board of Supervisors and then goes up for vote in the public before that becomes initiated. So that's the latest. That's very good news on that we're trying to move in the direction we want to move forward in, and really see an ability to coordinate on a bigger level. Chester.
Sissy, who wants to take lead on this?
Who's the soup?
Yeah.
Yeah, I until I get permission from their office to be public, I have to hold off on that.
Okay. Thank you.
Sorry about that. Yeah.
No problem. No problem.
It shouldn't be anything secret. I just don't feel comfortable until I get it confirmed. But this particular supervisor is very feels like it's very much in alignment with their goals and really concerned about food security and food justice. Questions, comments? So the next steps for this group would be to bring back those, there's a couple folks that are working on putting together, just taking the, what we had as the proposal and just putting some more detail into it. That detail would then come back to the Food Security Task Force for us to look at. Some of the detail would be, what does that community advisory board look like? We are using the task force on committees has recommended a particular, they have a particular template that we would follow that example. And we'd come with some proposals of seats, but that should be a discussion for our next meeting. So be prepared to look at that. And then just a little bit more working some details of what that some of the duties of the citywide food coordination. And if you want to be part of that, please let us know. Please email P. She can put her notes in there. Happy to have you participate in that. But again, please be prepared to be in our January meeting as we talk about that. Questions? It's a quiet group today. P, did I miss anything in there?
No, just shout out to Alex and Emma from the food bank, Beth with environments, Eric and Katie for participating in this process. anyone is interested in participating, I dropped my email in the chat. Just let me know and I will add you to our planning meetings.
Yeah. Great. And Jade or anyone, did anyone have any feedback from the folks in those meetings? I think they were. I think overall folks are concerned about food security in the city and the coordination around it and the so I think it's been very receptive. So I think that's a really positive sign. Obviously the these threats that we're talking about are all good support for why we need to really work together around these issues, because you can just see that there's a lot more barriers and issues coming down with this federal legislation. Okay. Opening this up for public comment. Okay, I am not seeing any hands up. Not seeing any notes in the chat. All right, let's move on to updates and emerging issues.
Hey, CC, this is Michelle. I can go. So last month, I talked about how DCOF wanted to be intentional about how to help families during this difficult time. And so after our interest survey, we have launched a pilot program to provide supplemental meals for families. So what that means is when the families come pick up their child after school care, when families come and pick up their child at their after school program, they can also take meals home that they can supplement with whatever else they have. And so currently we have 9 sites doing that, and it's about 250 additional shelf-stable meals that they can take home. Most of the sites that signed up are in our Tenderloin and Mission sites, but this is only a pilot program, so it's going to end at the end of January. But I can provide more details about feedback once, we just started. So, I can provide more information and details later.
Great. Thank you.
Christy, can I pose a question?
Sure.
Hey, what funding are you using for that?
We are using our own own children and youth fund, general funds. We're not using USDA funding. Yeah.
Got it. Okay. Thanks so much. And thanks for doing that, Michelle.
Mm-hmm.
Other updates, emerging issues. Want to thank Cindy and the team at HSA for updating on the cards. That was really helpful to know. And thank you for the information out there for the CBOs to encourage folks to use their cards and offer assistance with that, with those emergency grocery cards. Other updates? Okay, I'm not seeing any. I do want to update that our next, we usually do not have our food security task force meeting is usually the first Wednesday of the month, but in January we either cancel that January meeting or move it. We'll probably move it in January just because we have a lot going on. And so just to give you the heads up that usually is on it may be on a later Wednesday in the month or canceled. So FYI. Okay. Thank you all. That we will end this meeting early. Any other public comment before I adjourn? All right. Thank you all for being there, and appreciate the presentations today. And y'all have a good rest of your December, and we'll see you in the new year.